not done yet. It is the inner workings of the testes, part 5, and male reproductive system. My name is Elisa, and let's get started. Maybe. There it is. So inside means we're going to be probably looking at that histology, right? What those cells look like. So this is a cutaway in a microscope image. This is not a testes. This is like a set of cells within the testes. And so what we have here are let's start. I'm going to start somewhere, not at the top of this picture, but yeah, here. These are the spermatids, the little baby developing sperms, right? So tiny nuclei, right? As you can see. The nurse cells themselves are much larger, right? You can see how they're much bigger. Let's see if that helps, right? So those nurse cells are going to be the cells that are going to be helping this little little spermatids develop into mature sperm over time. They're protecting them, blood, testes barrier, all that good stuff. Let's see. The lumen of the tubule means just like the inside of the tube, right? A lumen, here's the tube, here's the inside of the tube. Tube's always a lumen. That's what that means. Um, the germ cells themselves, as you can see, are kind of like teeny tiny. You can see how we have like little dots inside of them, right? So those are developing packaged proteins as well. Connective tissue wall of the tubule is going to be this like protective kind of separating barrier all the way around. We have interstitial endocrine cells, which means they're not in the tube proper, but we do have them kind of like on the outside. And so they are producing specifically chemical messengers for endocrine. So in order to leave, they are going to need to use the seminiferous tubule itself, which is going to be this lumen. So the seminiferous tubule is like the entire like nursery, like delivery system in and out of mature sperm. Here's like a little blood vessel, right? So it doesn't go like right in the middle. It actually has to traverse. Remember, the nurse cells have to monitor what's going in and going out. The rete testes is a network on the posterior, right backside of the testes that's going to collect all that sperm that has matured from the nursery in the seminiferous tubules. And so sperm are going to flow in a fluid medium. They require a fluid medium. And so the nurse cells are going to start them off with some of that. At this point, they're not actually properly swimming. They don't actually swim while they're in the male reproductive tract because they don't have to. And it's super important to save energy because they have quite a ways to go. From what I understand it to be, it's most fertilization actually occurs not in the uterus, not even close. It's like up in the fallopian tubes, kind of further up actually. So it's a lot of space they need to cover. The testicular artery is going to supply to each testes, which we looked at. Low blood pressure of the testicular artery is going to result in not a ton of oxygen to the testes, but it's also going to result in us not being able to have like so much hot blood circulating over the course of the testes. So like there's a trade-off. What ends up happening is sperm are able to develop large mitochondria. We think to cope with this poor oxygen supply because they feel like it's like definitely more hypoxic than the rest of the body, as well as it is hypoxic in the human female reproductive tract. There's no nurse cell there to give them what they need. They have to be able to kind of like survive for as long as they can on their own once they're in the female reproductive tract. Okay, so the blood is going to leave the testes through the papilliform plexus, as we saw, kind of wraps around, helping to create that nice cooling system. For each one of the testes, it's going to converge to form the testicular veins, where it will dump in eventually to the inferior vena cava, right, going back through the heart and all that good stuff. The left one, however, is interesting because it goes into the left renal vein, so they don't always go the same places, is the point. Nerves that are going to innervate the testes are coming from the thoracic cavity, which is kind of important because remember back when we were talking about embryogenesis, so they were up relatively high, right? And so this means that the nerves had also, developed relatively high up in the body itself. And then so over time we've evolved to descend the testes, and so thusly like we still have them innervated relatively high up in the body in the thoracic cavity. like at the bottom of the thoracic cavity, but still it's there. Sensory fibers are concerned with things like pain or sympathetic, right, for blood flow regulation. Testes are kind of, this is a great cutaway. I really like this one. Okay, so here's the testes, and I want you to start with this. Like this is a lobe, right? Like a lobule, like a lobe in each one of these. And so this is when we looked up earlier at that histology slide, which is, it's always hard to get through histology, but the seminiferous tubules are like all wound up in here, right? All wound up. Remember, and there's nerve cells and spermatids and germ cells and all that baby stuff, baby sperm stuff, and they're going to develop. And then when they do, they're going to exit that lobule, going in here to this like reed testes, which is, kind of a plexagy itself, a little bit of a matrix. And the reed testes is going to take it up into the epididymis, right? It still has to go through these, what we call like the afferent ductual systems. And so here we have epididymis, and it's going to surround, it's kind of like that last final stopping point before we're actually going to go ahead and dump it all the way into ductus deferens, and that's like mature sperm, and then they leave. Right, tunica vaginalis, right, just kind of protective layer down here. Albigina, so it's like, white, right, is what that is, lots of connective tissue. Yeah. Tail of the epididymis is down, it's inferior, superior is the head of the epididymis. Okay, yeah, that's pretty good. Okay, sphernatic ducts from the testes to the urethra, the efferent ductules. So about 12 of these little ducts, which have cilia, are going to collect the sperm from the reed testes, and they're going to kind of like paddle it up towards the epididymis proper. The epididymis has a head, a body, and a tail. And basically, this is like college and like storage for these sperm. So they're going to mature here. They'll sit and hang out for a while. They can sit there for like a month and a half to a couple of months for the most part. But remember, sperm have to have that like high turnover rate, right? So they're not the same as oocytes, as the eggs. Contains each one is going of the each duct of the epididymis is going to contain a single coiled duct, and it's huge. It's like 6 meters long. Yeah, yeah, large. And so that's going to be towards the back of the posterior of the testes. Sperm are going to kind of like have a long time to be there because 6 meters is a way to go when you're not using your tail and just moving along the cilia. And so it gives them plenty of time to mature as they travel through. If it's not ejaculated, basically what happens is the epididymis says like, well, we're not just reuse it. We'll just reabsorb them, reuse the parts, recycle. So classically known as the vas deferens, the ductus deferens is where these mature sperm are going to have finally graduated onto. It's a relatively muscular tube of smooth muscle. It's shorter, 45 centimeters long, so definitely not 6 meters. It's passing up from the scrotum itself through the inguinal canal and posterior to the surface of the bladder, going up around it where it has to meet with some of its accessory organs that are going to help produce the actual semen. The sperm is different from semen. Sperm are actually the cells, and semen has like all kinds of extra stuff in it and primarily fluid that are going to help it actually swim. It provides a media, essentially, like a really supportive media, which we'll get into in a bit. So the duct widens up behind the bladder into the terminal ampulla, which is like that larger space, right? Like a lobby, if you will. So the duct is going to end by uniting with the duct of the seminal vesicle, which is going to help start putting components of semen into it. The thick wall of the smooth muscle is well innervated by the sympathetic nerve fibers, so it knows when it needs to kind of start mixing sperm with the components of the secreted semen. Ejaculatory duct. So 2 centimeters, like much smaller, duct formed from the ductus deferens and the seminal vesicle is going to pass through that prostate and empty into the urethra, right? Final stages. We talked about this again. Here it is, okay. So here we go. Epididymis, it's the head, it's the tail, and then we're going to move into the vas or the ductus deferens, which we will travel into the ampulla, and we'll sit in that nice little lobby. until we are going to meet with the seminal vesicle over here, which is going to dump us into this ejaculatory duct, which is also going to help us meet with the secretions from the prostate as well, which is going to thusly create, and the bulbourethral gland. So this is going to help us form that supportive media of semen, which is going to carry the sperm into the urethra for ejaculation. Okay. Oh, here's a much better cutaway. Yeah, it's just right here. Here's the lobes, right? The little nurseries themselves. And then the efferent ductules, so they're going to go in, right? And then here's the epididymis itself. Maturation, remember, 6 meters, right? Wow, that's so long. It's a long time to get in there. Ciliated, so they're not swimming, saving that energy for when they get into the uterus and fallopian tubes. And here we go all the way up through our ductus deferens. Then we're going to pour into that ampulla, that lobby, if you will, holding the sperm. Now, the sperm at this point is not semen. So semen has to be sperm plus all kinds of different secretions that are going to be mixed in with it to allow for really good media delivery system out through the urethra and then eventually the penis. All right, that was it. Okay, so that's it for that. So those are your spermatic ducts. Those are your highways and your mixing points and your maturation of sperm. And I hope that was super helpful. And I hope you're out there somewhere having a wonderful day. Bye-bye.